Good day, this is Princess Esguerra and will present the timeline of discovery in medicine advancement. On year 1799, smallpox vaccine was introduced by Dr. Benjamin Waterhouse to administer the vaccine in which he gave to his family members including his son. On year 1846, John C. Warren, one of the most renowned American surgeons of the 19th century, demonstrated the first public use of surgical anesthesia. On year 1927, Philip Drinker invented the first iron lung, a respirator that has helped save lives, especially those afflicted with polio and other cases of paralysis. The invention stemmed from research on methods of resuscitation for victims of gas poisoning and electric shock. Early models of the respirator encapsulated the patient's entire body, while later ones provided an opening through which the head could rest outside of the chamber. Fitting a collar around the neck of the patient ensured the chamber itself remained airtight. On year 1945, a pap smear, also known as a pap test, is an important part of routine healthcare because it can help detect cervical cancer and other conditions early. And early detection can lead to more successful treatment. On year 1979, magnetic resonance imaging, or MRI, is an important diagnostic tool because it can create detailed images of the inside of the body without using ionizing radiation. This makes it especially useful for imaging soft tissues like muscles, ligaments, and tendons. On year 1980s, researchers at Harvard Medical School and affiliated institutions make and continue to make to this day numerous key discoveries in the HIV and AIDS field. On year 2000, McLean Hospital researchers have identified 4 types of brain abnormalities linked to child abuse and neglect, providing the first comprehensive review about the multiple ways in which abuse can damage the developing brain. On year 2006, Dana-Farber researchers identify a molecular mechanism in the liver that explains how eating foods rich in saturated fats and trans fatty acids causes elevated blood levels of so-called bad cholesterol and triglycerides, increasing the risk of heart disease and certain cancers. The discovery may be a first step towards drugs capable of turning down the mechanism and lowering the chances of heart disease. On year 2020, HMS neurobiologists defined the underlying mechanism of loss of smell, the main neurologic symptom of COVID-19, and identify a class of support cells in the nose and forebrain as the main target of SARS-CoV-2. The findings indicate that the novel coronavirus changes the sense of smell in patients not by directly infecting neurons, but by affecting the function of supporting cells. And on year 2023, researchers in the HMS Department of Biomedical Informatics find that the sex hormone estrogen not only can fuel cancer, but can actually drive genomic rearrangements that lead to breast cancer. The work explains many cases of the disease that don't fit in the classic model of breast cancer development. The positive contribution of it in the society is improved healthcare. The world has now become advanced to the point scientists and researchers can find and formulate a cure for certain diseases. Example, tuberculosis didn't have a cure back then, but with multiple scientists trying to find a cure, it is now treatable with taking antibiotic for 6 months. And on the negative side, not all people can have access to these services. Some can be really pricey, that's why there's an equal access when it comes to medical care. And Philippines should adapt to these changes and advancements so healthcare facilities could provide enough and sustainable healthcare for patients.